Your gut to blame for things like chronic fatigue, generalized achiness, brain fog, and a collection of symptoms that just won't go away? Have you been to multiple doctors, run countless tests, and they keep telling you that everything looks normal? But here's what they're not telling you. There are 3 hidden gut problems that might be the missing piece of the puzzle. And here's what really sucks is that conventional medical approach is completely ignoring many of these scientifically proven issues that can happen to our guts. And it's simply disappointing and frustrating to see people that aren't being told what is really happening with their gut and with their health. So buckle up and get ready as I reveal these 3 hidden gut problems, because once you determine if you have one of these gut issues and you actually address it, it could change your life and your health forever. I'm Dr. Josh Shields, a certified functional medicine practitioner, and I've helped thousands of patients reclaim their health and vitality by uncovering these hidden gut problems that conventional medicine often overlooks. And I do these videos because I really want people to understand the truth about health and how to achieve it. So today, what I'm about to share might challenge everything you've been told about your health issues. Now, these 3 hidden gut issues aren't just theories. They're proven mechanisms that have helped my patients break free from the cycle of symptoms and frustration. You might recognize these symptoms: crushing fatigue that no amount of sleep seems to fix, mystery weight gain or inability to lose weight despite your best efforts, brain fog that makes you question your mental clarity, mood swings, anxiety or depression that seem to come out of nowhere, digestive issues like bloating, gas, or irregular bowel movements, food sensitivities that keep multiplying, skin problems that dermatologists can't explain, and joint pain and inflammation throughout your body, hormonal imbalances that conventional doctors miss, and frequent infections or feeling like your immune system is weak. And I know this was a ton of stuff I just went over, but the truth is that your gut is the foundation for your entire body and all of your health. The problem that we're seeing with conventional medicine is that they're simply looking at symptoms in isolation. They're not looking at how the entire body interacts with itself to create good health. And I got to tell you, the gut microbiome and intestinal barrier are extremely important. But here's what's fascinating is that researchers are now doing fecal transplants where they take the fecal matter from a healthy individual and they put it into an unhealthy individual. Studies show that these transplants can help reverse diabetes, improve someone's mood, and can even contribute to people start losing weight once those transplants have been done. And another amazing feature of your gut is that approximately 70 to 80% of your body's immune cells are located in the gut-associated lymphoid tissues. So your digestive system isn't just about processing food, it's the command center for your entire immune system. So when your gut is compromised, it creates a cascade of problems that can make you feel horrible. But once you understand these 3 problems and discover whether or not you have any one of them or all of them, and you address these issues properly, it can literally change your life. So let's dive in. The first hidden gut problem that can destroy your overall health is leaky gut syndrome, and this condition affects far more people than most realize. So here's what's happening is that your intestinal lining is supposed to act like a selective barrier. It's allowing the nutrients to pass through while keeping the toxins and the fecal matter and digested food particles in your intestines out of your bloodstream. But when this lining becomes damaged from stress, from processed foods, medications, infections, from pesticides, it develops microscopic holes. Now, this allows things that should stay in your gut to leak into your bloodstream. Now, when we talk about intestinal permeability, the scientific term for leaky gut, there's over 20,000 research articles on PubMed that you can find about this condition. It's well documented in science. These studies show that increased intestinal permeability can affect everything from your mood to your hormones, to your metabolism, and even heart disease risk. And this is why gut health is so crucial for your overall wellness and can even impact your weight management. What happens is that when these particles of waste seep out through those intestinal walls into your body, they start to irritate and damage the tissues and the cells in your body, causing inflammation. See, that's what inflammation is it's simply damage to the tissues and the cells, and that damage then leads to the immune system becoming activated. So those cells can be your organs, your glands, your tissues, and those then become damaged, resulting in the inflammation, the swelling, and the damage of those tissues. Unfortunately, when those cells and glands and organs or tissues are damaged, it can contribute to your hormones not working properly. And basically because your body doesn't respond to hormones in the way it should. See, if you look here at this picture, if you look at this cell is going to function properly when the hormones get to it. Versus this cell, when the hormones get to it, they're not going to function properly. And so what's going to happen is the body has to respond appropriately by increasing the amount of hormones it produces. So this creates, in a sense, hormone resistance, where the body's not responding to the hormones. And one of the hormones that can be impacted by this inflammation, by this waste leaking from your gut and your body, is insulin. And researchers have now found that inflammation can actually cause people to gain weight faster and are more likely to become diabetic if they have inflammation. And one interesting research study they measured the inflammation, that marker called C-reactive protein, and tracked their changes to their BMI over time. And children with the higher levels of CRP gained significantly more weight, despite being overweight at the start of the study. This suggests that low-grade inflammation may predict future weight gain. That's what they said in the study. So why does this happen when you have inflammation? What happens with inflammation is that your body's going to have to create more insulin to create the same desired effect, because the cells just aren't going to respond like they used to. And what's happening is this insulin is actually a growth hormone. It causes your body to be storing more glucose than creating more fat. But here's where it gets really problematic for your overall health, is that this inflammation can also contribute to fatigue. See, when you have these damaged tissues and cells, the immune system has to become more active to try and fix the damaged cells and tissues. And this is going to pull your energy down. And this is why you start to feel achy and kind of lethargic, because your body's immune system is fully active with inflammation, like if you had a low-grade cold or a flu all the time. And this is what I see in my clinic as patients are coming in, they're like, I just achy and I just don't feel well, Dr. Shields. Studies have shown us that people with leaky gut often have elevated levels of Lipopolysacharide in their blood. And this is a toxic compound that can be created from harmful bacteria. Research in rats have demonstrated that those with the higher LPS levels tend to have a slower metabolism and gain weight more easily. Look at this mouse here. This mouse over here had the same amount of activity, ate the same amount of calories, but as you can see, they have completely different body weights. So what's the difference is that these rats were injected with the toxin LPS. The difference is striking, just showing us how powerful the impact of these bacterial toxins can be on our overall health and metabolism, even when everything else remains constant. The second gut problem that can contribute to your health struggles is an imbalance in your gut bacteria, is what we call dysbiosis. This is where things get really interesting from a digestive function perspective, is that you have trillions of bacteria living in your digestive system, and the balance between the beneficial bacteria and the harmful bacteria can significantly impact your overall health. Here's why this matters, is that the beneficial bacteria actually help produce a short-chain fatty acid called butyrate, which can help regulate your metabolism and reduce your inflammation. These bacteria also can help with nutrient absorption and can even influence your appetite and cravings. But when dysbiosis occurs, when you have an overgrowth of harmful bacteria, it often comes with compromised digestive function. You might have low stomach acid, insufficient digestive enzymes, or damage to the intestinal linings that affects how well you absorb the nutrients, basically leading to the leaky gut, which we already referenced. So when these harmful bacteria outnumber the good ones, several things can happen that can make optimal health more challenging. First is that harmful bacteria can contribute to increased inflammation through the body because the bacteria stresses the immune system and creates more metabolic waste in the body. One example I always like to give my patients is that if you have one dog that pees and poops in your backyard, no problem. But if you have 100 dogs that pee and poop in your backyard, now you've got a big problem because of all that extra waste is going to be damaging your lawn. Well, the same thing happens in your body. And that's what we see with patients, is that when they have an overabundance of this bacteria, that overabundance creates more waste and more strain on the immune system, causing inflammation. Second problem with this dysbiosis is that it can also affect your energy levels. When your gut isn't functioning optimally, you may not be absorbing the nutrients efficiently, even when you're eating healthy foods. This poor absorption can leave you deficient in key nutrients like B vitamins, magnesium, and zinc that are crucial for optimal health and metabolic function. The result is that you feel tired and sluggish despite eating well. The third problem with dysbiosis is that when food isn't properly broken down, it can actually lead to feed the harmful bacteria in your gut, creating a vicious cycle. These bacteria then prefer sugar and processed foods, and they can influence cravings, sending signals to your brain that make you crave the very foods that feed them. So this combination of poor nutrient absorption, increased energy demands from the compromised digestion, create a perfect storm for fatigue. And this fatigue makes it harder to stay active and significantly reduces our mental energy. And so what I commonly see is patients feel a state of overwhelm and anxiety because they simply don't have the energy or the resources to do life as well as they know they should. So it makes everything seem more monumental, more overwhelming because you just don't have the energy to do life. So dysbiosis in the research has shown us has been linked to allergies, autoimmune diseases, psoriasis, hives, and eczema, and mental health and neurological disorders like depression, anxiety, autism, Alzheimer's, Parkinson's, and even linked to cardiovascular disease, including hypertension, arteriosclerosis, and heart disease, as well as food intolerances, skin problems, hormone imbalances, oral health issues, and a weakened immune system. As I mentioned earlier, this is what's so frustrating is that people are walking around with all these gut imbalances and many times don't even know it because they don't have any obvious gut symptoms, but they're suffering needlessly because they're just not aware that they have this problem. But before we continue, I want to take a moment to ask for your support. If you're getting value from this content, please consider subscribing to help this channel out. Many of you right now watching this aren't subscribers, and if this information is helping you understand your health better, your subscription really helps us continue creating this content for you. Also, I've pinned a link below in the comments to a full training where I break down the 5 essential pillars that have to be addressed when you're trying to fully heal. There is nothing to register for or an email required. Simply click the link in the comments below. Now, back to it. Problem number 3, the third hidden gut problem, involves something called the Estrobolome, a collection of bacteria in your gut that can influence hormone metabolism, particularly estrogen. This is especially important for women, but men are affected too. Now, your estrobolome helps you regulate how your body processes and eliminates estrogen. So when this system isn't working properly, it can contribute to hormonal imbalances that affect your overall health and energy levels. For women, if estrogen levels are too low, it can make it more difficult to build muscle and maintain muscle mass. And since muscle tissue burns more calories than fat tissue, this can slow your metabolism. On the flip side, if your estrogen levels are too high, it can contribute to weight gain, cysts, fibroids, heavy periods, acne, and even cancer. Now, I don't know of any one particular test that can look at just the estrobolome, but instead factors that affect the estrogen metabolism, things like the abundance of good bacteria or beneficial bacteria, beta-glucuronidase, which is an enzyme that helps with estrogen metabolism. And of course, we have to look for that leaky gut because if the gut is leaking toxins in the body, it can also cause estrogen resistance, just like insulin resistance that we discussed earlier. And this estrogen resistance is going to occur because when you have damaged cells, tissues, organs, and glands, their body's going to have to produce more estrogens to create the same desired effect. So what's next? Testing and solutions. So how do you know if these gut problems are affecting your health? As I've mentioned, you don't have to have any obvious gut symptoms to have a gut problem. And this is why I recommend functional medicine providers, because we can run comprehensive stool testing or SIBO testing that reveals the state of your gut microbiome. It checks for inflammation markers, and we can assess digestive function. These tests can show us exactly what's happening in your digestive system. We can also run blood tests to check for elevated insulin levels and C-reactive protein levels, which are both crucial markers that help us understand the full story of what's happening in your body. But you don't have to wait for the testing to start making improvements. Here are some lifestyle changes that can help support gut health. First one, limit alcohol consumption. Alcohol can contribute to leaky gut, and it absolutely can destroy your microbiome and the ratio of good bacteria to bad bacteria. Use antibiotics sparingly and only when necessary. While antibiotics can be helpful when needed, they can also wipe out beneficial bacteria. If you do need to take antibiotics, make sure to focus on rebuilding your gut bacteria afterwards. Now, I recommend using a good broad-spectrum probiotic, but also make sure to take one with arabinogalactans in it, which is a great prebiotic that helps stimulate the growth of the good bacteria. And unfortunately, you're going to have to supplement with arabinogalactans because you can't eat enough of the foods required to get the beneficial therapeutic dose. Now, you can eat foods that also stimulate butyrate and other short-chain fatty acids. Now, these things can help heal the gut and reduce inflammation and repair the leaky gut. These foods are resistant starches like cooked or cooled potatoes, green bananas, inulin, which is found in chicory root, onions, and garlic, Also consider fermented foods like sauerkraut, kimchi, and kefir, which can help introduce beneficial bacteria. Now, if you find that eating any of these foods that I've mentioned so far, or that taking probiotics makes you have more bloating, pain, or nauseousness, then you definitely need to consider meeting with a functional medicine provider, because you may have an overgrowth of bacteria in your small intestines called SIBO that could be fed with these fermentable foods or probiotics, making somebody's digestive symptoms even worse. Now, you also need to manage stress through practices like meditation, yoga, therapy, or regular exercise, as chronic stress can also contribute to chronic gut dysfunction. You'll need to prioritize sleep, as poor sleep can affect gut bacteria balance and can contribute to inflammation. But the key here is understanding that your gut health is the foundation of your overall health and your ability to feel vibrant and energetic. So when you heal your gut, you're not just improving digestion, you're supporting your entire body's ability to function optimally. So drop a comment below. Let me know if you've experienced any of these gut-related symptoms, or if you have a question about how gut health might be affecting your overall wellness journey. I read every single comment, and your question might just inspire valuable content that helps others too. Until next time, this is Dr. Josh Shields reminding you that your best health is not behind you, it's ahead of you. And with the right approach to gut health, it might be closer than you think.